on Friday. The carpool days are full.
We're going to call the meeting of the Mason County Board of Health to order. Today is May 23rd, 2017, and I welcome everyone. Let's do introductions. Terry, let's start with you.
Terry Jeffries, Mason County Commission District 3.
Randy Netherland, Mason County Commission also.
Kevin Shooting, Mason County Commissioner, District 2.
Kathy McDowell, Commissioner of Finances for the city.
Peggy Van Busker, Hospital District Number 2 Commissioner.
Diana Yu, Health Officer.
Dave Wyndham, Director, Mason County Community Services.
Thank you. Did everyone get a chance to look over their minutes? The last meeting, March 28th. Oh, the agenda.
I make a motion, we approve the agenda as
Oh,
submitted.
that's right. Excuse me, I see that. Okay.
I'll second that.
Okay. Okay, so, motion to, all approve the, agenda?
Aye.
Aye.
Opposed? Motion carried.
Madam Chair, move for the approval of the March 28th minutes.
I second that.
All in favor?
Aye.
Aye.
Not in favor, I can't think of the word I want to use. Opposed? God. All opposed? Motion carried. So we will have our health officer report, Dr. Yu.
Yes, and actually I have a short report today, and what I have with me is I just brought our Mason County opioid response plan. So this is not anything that is new. You've seen this multiple times. We discussed it at the forum. We've discussed it on the board meeting, but it came to our attention as we were trying to apply for a grant that we didn't have an official Mason County opioid response plan written out. So, did I get you?
Yeah, I know.
Okay. So I put this together, and it's basically it's the bare bones skeleton, and this is patterned after the Washington State opioid response plan with just a little bit more details under each of the main sections. I do have our working plan, which is like a 7-page document, which just goes into just a few more details. So if you were interested in looking at that, I can certainly. But it still says draft on it because it's a working plan. It'll never be finalized because I keep updating it every time we do something. So we can discuss, you can ask questions, we can make some changes to it, but this is just a bare bones skeleton, and the reason why I did it that way was so that we didn't have to keep changing this when we change our little strategies and tasks under what we want to do. So the main things we want to do in our opioid response plan for this county is to, number one, prevent the use of opioids, improve access to treatment, reduce deaths from overdose, and to use the data that we have wisely. How we're going to do that is kind of drafted in a little bit more detail. And actually, I should give it to you. This is not a public document because it's a work in progress. I can certainly share it if you want to just quickly. It's probably more than you want to look at and read right today. But so in it are things like, doing the drug treatment agreements with the pharmacies so that we have more Narcan, getting the treatment available in different areas.
wanted to share that under access to treatment, C, we do increase community capacity for substance use disorder treatment. We do have a new provider coming to town, opening up shop, taking patients July 15th.
Yay.
Right downtown here. They're called Consejo. And they'll be doing both mental health disorder as well as substance use disorder, and they're bilingual. And they are purchasing, or their investor group has purchased the building right next to, the brick building right next to the transit center. So they just met with our drug court, or therapeutic court team today, and very excited to have them on board. So,
What's the name of that?
Consejo, Consejo.
Okay.
And then we do have, it's not real extensive, but Peninsula Community Health Services in Belfair has one behavioral health treatment provider on staff there. And I think that they have the capacity for assessments. They'll have a psychiatrist in the office at all times, but I think the assessments can happen.
So as you have developed and find out more, you would shoot me an email so we can update our plans as we go? Because exactly that, I know that any day now, Northwest Resources is going to be starting their Suboxone program. You know, it's something that's in progress that we're working on. And then as we create more capacity in the community, we'll need to keep updating our document. I'm trying to figure out, it's easiest to just go ahead and send it to me or to Lydia. And probably best to
Peninsula
get it
Community
to
Health
Lydia.
Services will also prescribe
Right.
Suboxone.
Peninsula is have they opened?
Yes.
Their
Yes,
plans? Okay, because I missed the open house. Yeah. So, right.
Any other discussion or questions that we have? Thank you. Are you done?
So I think we would like a motion.
Okay, like a motion.
To approve this.
Okay.
As if that is something that you wish to
I
do.
will make a motion to approve the Mason County Opioid Response Plan as presented to the health board today.
Do we have a second?
I'll second.
Okay. All in favor?
Aye.
Opposed?
I'm going to abstain. I just got it. I haven't had a chance to read it.
It's just this part. not
It's
the
all
big one.
condensed. Yeah, it's on this
It's
one,
just
Carrie.
the-
Yeah,
Carrie.
you know.
Yeah,
That's okay.
that's fine.
Under principle, I prefer not to have to vote on something I've had a chance to look at.
All right. Next, we have our administration report.
Okay, we got cool stuff. Okay, so today is my 1-year anniversary of coming to Mason County. I had my first Board of Commissioners meeting and my first Board of Health meeting on my first day.
Happy anniversary to you.
So today is 1 year.
Very good.
Another announcement, I've been elected as the chair-elect for Wasaltho. So it won't be this year, it won't be next year, it'll be going into the next biennium. I'll be the chair of Wasaltho as we go into that biennium where we start working really hard on some budget and funding issues. So that'll be a busy year for me. So, but I think it'll be a good year, and it's gonna be really handy being right here close to Olympia to start working those things. So,
Mhm.
I think that's gonna be a win for everybody. Budget. So, as you know, the legislature is going to go into another session. If they don't have a budget by July 1st, so we won't have another meeting until July. If they don't have a budget by July 1st, I have to look really hard at public health. Anything that touches state funds, or we bill through state funds, we have pass-through through Board of Health that comes to us. We'll look at having to shut those pieces down unless I use the reserves. But typically we use the reserves in October, November, December when our revenues are light, and that's the kind of time that we wind up coasting anyway. So we'll be looking really hard at that. Things that will continue would be all the environmental health, fee-for-service activities will continue. So it won't affect anything upstairs, it'll just affect public health activities downstairs. So I'm hoping the legislature pulls it all together here pretty soon. They did this 2 years ago, and it was like a midnight thing on the last night, and then DOH took them a couple of days to get their act together. So we lost a couple of days of funding in, what was it, 2015? Yeah, 2015. We can see the same thing happen this time. So we'll just have to look at how it looks as we get closer to that. We'll have a better idea anyway, because we'll be past the 6-month mark at that point and have a pretty good idea what our finances will look like for the rest of the year. So I'm not too terribly concerned, but we may have to furlough for a little bit, depending on what the legislature does. If they get really bottlenecked, it could drag out a while. So I don't have a crystal ball on that one. So we'll have a plan by the end of June, and in very, very great detail on who will be there, who's manning the phones. Things will have to, such as birth and death certificates. That's a requirement. We'll have to do them. But I'm not sure how that will look if the state's not at the other end of that computer. So we'll see. Other things. So the Cascade Pacific Action Alliance met 2 weeks ago, finalized the limited liability company. That's the accountable community health for our region. Public health holds 4 seats on that board. 5 seats on that board. So we're well represented at CPAA, and they met with Choice last week. Major topic was the BHOs and Healthcare Authority, and do we want to look at mid-adopter or running out to 2020 for a full adoption of the full integration of behavioral health and substance abuse and physical health. So there's some things to consider. If they go mid-adopter, the BHOs lose, basically trading $30 million for $10 million. I'm not sure that the BHOs are going to be really tickled about that. And I'm not sure why we would want to go that early, but we'll see. I think CPA may send a letter to the boards, but ultimately it's the counties who decide when we go, if we go mid-adopter or if we go late adopter. So I think we take money off the table if we go too soon. So we'll see how it shakes out across the. So there's 2 BHOs involved. There's us, and then there's what, 5 Rivers? Great Rivers BHO.
Where's Great Rivers?
It's Grace Harbor,
Lewis.
everybody, all the other counties.
Yeah.
Okay.
And Grace
Okay.
Harbor, Lewis, Pacific.
Cowlitz. Wakayakum.
Okay.
So there's money that could be left on the table there. We'll see. Other funding out there with the Medicaid demonstration project. There could be up to $85 million for the region, but that's primarily going to be aimed at clinical care, not at prevention work. So, early on we thought a lot of money was going to be going to prevention, but it looks, in our conversations with Healthcare Authority, that it's really going to be aimed at clinical care.
And that's Medicaid.
Medicaid.
So is there a worry of any of that funding being gone with the new?
Nobody can tell.
Okay,
So they're moving forward as is.
all right.
So,
Gonna move forward just like there was the money there?
Right.
Okay,
right. So that's the assumption that's being made at this point.
okay.
But again, it's going to clinical, so even though the Medicaid, here's where I ran into some problems with it. So the Medicaid waiver talked about taking money out of clinical to roll back into preventive services on the social determinants of health. But instead of going to social determinants of health, they rolled it back into clinical care in a different way. So I'm not sure what we're gaining by that.
But we do get 3 pilot projects.
Right. Well, in order to get the full amount of money, we have to do all 8.
Right, and the others are already preset, and we don't get a choice.
Right,
on
right. So there's some that are preset. If you want to get the full amount of money, so essentially we're having to do the work up front for the first 3 years. First 3 years we get paid for our reporting. The second 3 years of the demonstration project will get paid on performance. So if the needles in those measured tasks start to move, then we start to make money in the second 3 years. So it's 2 different funding mechanisms. So it's an interesting time. I've never seen funding arranged quite this way. So and they're asking the ACH to assume the risk. So we're assuming all the risk up front. And then trying to determine who gets the funds down the road. So, I mean, it's honeymoon right now, but when the money starts to be distributed, that's when, if there's going to be a problem, that's when it'll happen. So, other than that, CPA is moving ahead, doing some, themselves set up to do some work. And that money will have to come down to the local forums like Mason Matters in order to get the work actually done out in the community. Because Mason Matters, has the muscle on the ground. CPA doesn't necessarily have those pieces in place. Now, we've talked about tobacco and there's three other funds we're talking about. So marijuana funding, DOH has decided, like it did 15 months ago, to send one marijuana funding to each region instead of funding the traditional people like public health who've done that work through tobacco for years. They decided to open it up for request for proposal. But you have to spread that money so thin, like butter on toast is the way I put it, that it doesn't make sense for a small jurisdiction like us to apply for the money because we don't have the population. We would have to partner anyway to get up to the minimum 100,000 population mark in order to apply for the funds. So in this case, we, as a group, decided to let CPAA apply as the contractor for this money for this go-around. But the public health folks have said, listen, while we'll agree to it, we want to see reporting, we want to see data on what was done over the last 15 months. There's just a lot of information we've not gotten that we feel that should be a requirement before we move forward.
Right.
So, tobacco had the same sort of a funding process as well. But tobacco, amongst the group, we decided that Thurston County Public Health is going to apply for the tobacco funds. And they'll be running the tobacco intervention program. Where I came from, Spokane did it, and then we wound up contracting with Spokane to do the work. So it'll be the same sort of situation here. If Thurston gets the funding, we'll apply to Thurston to get funding to come back to Mason County. Rather than trying to get services brought from Thurston out, I would rather contract for a small amount of money and have our health educators do it ourselves. We have more control that way. And the third one was a pilot project for public health as the chief health strategist for an ACH, or within an ACH, not for the ACH, within an ACH. And I felt we weren't in the position to jump on that right away, especially because the timeline on it was so short. So Danette York from Lewis County was going to move ahead with that. She kind of had something in the works anyway. So we all agreed, amongst the other 4 LHJs, that we would support Lewis County to move forward on that project and to at least have some representation in small rural health jurisdictions doing ACH work. Because I really fear that it's going to go to the really big LHJs. So we're hoping to get some money for this type of work in our kind of locales. So it's been a busy month. And a lot of wheeling and dealing, and lots of phone calls. So, and again, Friday we have the Foundation of Public Health Steering Committee in Kent on the Friday before Memorial Day. So that's going to be a fun day. We'll see how that goes. There's a pushback on some of there's been a push for regionalization or shared services to be the focus of the modernization plan. And a number of us are saying, we can't put all of our eggs in one basket like that. That's just not wise. So I think that's going to be the focus of this meeting, saying, okay, obviously this didn't go through this legislative session, so what's Plan B? And start working on Plan B, you know. There are some things we're already doing, and Dr. You and I have discussed this, and things we can do as shared services, but we can decide that amongst the LHJs. We don't need DOH or someone else, healthcare authority, to dictate what that looks like. We can figure that out for ourselves. So that's the message I'm taking to the steering committee on Friday.
Well, so it would be different for different services.
Right.
So there are certain things that would make absolute sense to share and others that
Health
does
officer.
not. So health officer is one that we've discussed. And there are certain things in terms of health officer duties that can be shared that would, make a lot of sense. Or an epidemiologist is another one.
Mhm.
But like disease investigation,
Partner notification, those sorts of things. Yeah, that should be done.
but TB, tuberculosis, can certainly be shared. Because, even with diseases, you could even split out what can be shared and what doesn't make sense to share.
Mhm.
So that's what I have on that.
Okay, thank you. We have someone make a motion that we accept the administration report.
I don't think you
We
need
don't have to?
Nope.
Okay, I'm learning here, The next one is the environmental health report. Debbie Riley.
Yes, I wrote on my paper and jumped ahead, tried to jump ahead of Dave. So, thank you. You got my little report, but I want to start off by telling you I got a second retirement notice. So I will have 2 of our long-term employees leaving the environmental health section in July. Cindy Wade will be going in the middle of the month, and Carol Spalding at the end of the month. So between them, they're going to be walking out the door with about 45 years of experience.
50 years of experience.
Mm-hmm.
So we've advertised. We advertised for the one we knew was coming, and then the other one announced. So we're busy looking at applicants for that. And they're going to be pretty excited, and I think they'll both do very well in retirement. Some people you kind of worry about, but I'm not worried about them. We're ahead on our on-site permits, so building is going strong right now. And just been crazy busy. We did another mailing, and this is for people who haven't had service in our records that we have in our system. The first time we did this mailing a few months ago, we sent out 4,000 reminders. 2,000 of those people got service done on their systems. So this mailing that we just sent out is only 1,900 people. So just really amazing when you remind people what they need to do.
Mhm.
For the most part, they tend to do the right
Mhm.
thing. So that's pretty exciting. Earlier this week, we had a code enforcement meeting. Many different departments and staff were part of that, and just working on fine-tuning and listening to good ideas that come out of those sorts of brainstorming sessions about how we more efficiently use staff time and what we can do to work together a little better. So that was a really good meeting. There was 3 people from the building and planning section, 4 people from the environmental health section. We had public works there. Sheriff's office was there for a little while. The prosecuting attorney's office sent a person. So we had some really good participation. Just wanted to let Commissioner know that we're looking at a new pizza place in Hoodsport in the old Forest Service building. So that's pretty exciting. Cody's been working with them. And
Where the visitor center is? So the Forest
It's
Service?
kind of like
Yeah.
across from like the Model T, I think.
yeah, up the road just a little bit there.
Across
Yes,
It's
Is
just
it
when
that
you
far
just
turn.
barely in.
It's
You
in that
just
little
turn,
footlet,
it's
right?
right there.
That's where the visitor center is.
Okay.
Awesome. Visitor center pizza place.
Uh-huh. And they're having a temporary event this weekend, but the business won't be open for 6 or 7 more weeks. But just to let you know, they'll be there doing something outside and using their kitchen sink and their restrooms for their temporary event, so pretty cool. Cody is also starting the pool and hot tub inspections. We usually, if the weather's nice, gear up around Memorial Day and everybody closes over Labor Day. But with this hot weather, we'll be getting some requests and some notices that people want to get started. We're working in both Hood Canal and South Puget Sound, McLean Cove, Oakland Bay, for water quality in those grants. And I think that's about it. As you know, we sent people to a lot of trainings because it seemed like they were all happening one week. They were local and they were free. So everybody's kind of happy and on that little high you get when you get to go out and meet with your peers and learn something new. Anything for me?
Any questions? Okay.
Thanks, Debbie.
We will now have the community health report. Lydia.
Hello. So you received my report as well. I'll highlight just a couple of things on it. Just communicable diseases, I kind of thought that'd be kind of fun to start showing you how many we actually do every quarter and we investigate. So we had 212 investigations or entries. Some of those are just hepatitis C, not just hepatitis C, but they don't require a complete investigation, but we do have to look over them and we have to enter some information into the state database, so it's work. It's one of the ones that we don't like as much because it's hard. But so not a whole lot new there. That's pretty average. You can start watching and see how it goes up or down, but we're happy that though these investigations happen sometimes like the pertussis, we get a lot more calls than this, but sometimes they never pan out to be measles or pertussis or something, but they take time, so. Our immunization program's moving along nicely. We have a new pharmacy. We have 2 new immunization providers in the community. One is the Shelton Pharmacy that's up on Olympic Highway, and he's also doing travel vaccines, which is very exciting because I don't think we've had travel vaccines in Mason County since we closed our doors.
I've been doing travel vaccines
Have you?
for 12 years.
Oh, okay.
So
Well,
just
gives you them all.
I do them all.
Oh, well, our front office needs to know
Not for
that,
I-
right?
I'm registered with yellow fever and all that.
I think you're fine.
Well, I've never been aware.
Yeah.
So,
It's
anyway,
on my,
so North County's covered
yeah.
because QFC is doing them out
And-
there.
Safeway doesn't do them, right?
They do some
They do a
travel
few,
vaccines, they
yeah.
don't do yellow fever.
Okay. Who does yellow fever?
I do.
Okay.
And you generally have to order that ahead of time, right?
Yeah,
Does anybody even use them?
yes.
They
Yes,
do?
there's actually.
No, I
They're
meant,
going
no, I
to
meant,
Panama.
I meant Safeway.
Oh, I
I
don't know.
never see anything happening
Oh,
over there.
You're not.
I shop UFC.
You were speaking of the one over.
Yeah.
in Belmar,
Yeah.
here.
Yeah, in Belfort.
I hear you. So, and then our new clinic, our Belfair Clinic, the, why did I just find it? Peninsula Healthcare.
Community.
Yeah, they hadn't, they're still waiting on the refrigerator to be approved by Department of Health, but they're ready to go on vaccines, and they'll be children's vaccines there too. So, yeah, we're real excited about that in the North End.
I have a question.
Mhm.
On these communicable diseases, you have flu 9. Is that people who get it severe? What is, or they're
Influenza is technically not reportable, but people do report them. They let us know.
that they
So
have it?
That somebody's been usually it's hospitalization and or death.
Okay, but not
So-
just someone who gets it and is in bed for a couple weeks at
Sometimes
home?
we do get that when the lab test is positive, we get a report and we just say thank you and we don't do anything.
I see,
Because
okay.
it's not a reportable condition that we have to log in and report. So influenza the data that you get about influenza is pretty much calculated rather than an actual number, because it's not a disease that is reportable.
Right. And then here it says lead, 1. Is that,
It's investigation of lead with children.
Elevated lead levels
Lead
is
levels.
reported.
so when someone gets lead poisoning, you go in and you investigate?
It's when a child, testing is done for children
Mhm.
now, and so pretty routinely, and so when we get a child with a positive
Okay.
lead, it comes back
All
and we have
right.
to report it to the state.
I
And then we
see.
do follow up with the
And it's
family.
usually
Okay.
an environmental health follow-up, so where do they
So
go?
generally what they have is a finger prick, and then is followed up with a venous draw to confirm. And in most cases I've seen, the venous draw doesn't show the same results as a finger prick, so.
Okay. Very good, thank you.
And the flu there would be ones that we actually were influenza A or B that we actually did receive a report, because a lot of people can say they have influenza, but not everybody's tested.
They were testing regular at the clinic, and I know I could have tested, but I tested negative.
Okay, thank you.
And then our opioid overdose program, getting the naloxone out in the community is working really well. And I was hoping Abe could be here today, but I think he had another meeting that he had to attend. And he's getting the kids out. We're real excited about it. Our law enforcement's getting them. We're kind of learning lots about things we can and can't do as we move along, since we're a pilot project for the state. And we're hoping it'll be continued after August. They haven't said anything yet, but we also did apply for a juvenile justice grant, Department of Justice grant, that we won't know or hear until September whether or not we receive that, to be able to continue the program for 3 more years.
So some of the things that we're doing in that is really working really hard at partnering with the tribe as well, because we have not, they've done different programs with their law enforcement as well in the tribe, is Skokomish, and then the Squawks in Medical Clinic does a different program. So we're now partnering so that we understand what's going on in the entire community.
Okay.
Our nurse family partnership has some great outcomes. We're constantly, it's one of the, I consider to be the highest data collected program in the entire nation. But there's some of the data that's collected, and we're doing well, as you can see, in comparison to the national data or the state data, so we're excited about that. Housing, our RFP housing will be coming out and announced soon. We had 14 requests for program funding from our housing funds, and everyone's getting something, but not everybody's getting everything that they requested, because as you see, there's $300,000 to put out in the community and $675,000 of requests. So there's lots of needs out there for housing. And mental health is also being worked on right now. The RFPs are due Friday, yeah. So that's the next one that'll be coming through. We did some training, emergency preparedness training, in this last quarter for our community, or for our staffing, which is really great. We have a lot of new staff in public health, and many of them, though, they have to immediately get their incident command system training, the ICS. They don't really understand how it fits within our day-to-day work. So we have a contract worker that we work with from Lewis County. He's the emergency preparedness coordinator down in Lewis, and he comes up and usually tries to use public health, so he incorporates really things that happen with our environmental health and our community and family health, and gives them an example, and we do little tabletop exercises to kind of demonstrate how to utilize. And then we worked with our management team, and we did a continuity of operations, which is COOP, plan review, because we also have new managers in the building, and we wanted to begin to expose them to what our plan is. So.
Because we had a live drill.
And we had a live drill, we had power outage. which is always a good thing to have an actual event, especially when it's small and it doesn't last too long, but it was long enough.
And where'd that take place?
Where did it take place? Well, it took place in all of downtown Shelton. So when the power went out.
Oh, and it wasn't a planned power.
No.
Oh, I was thinking,
Actual
I thought you were,
event.
okay, I got it now. I thought you had, okay, I
It was
remember, yes.
Yep, an actual event, so we have to
Yeah.
figure out how we're going to respond
Very
and
good.
do our work.
Communicate how we
Very
can
good.
work.
Yeah, because our phones go down now
Mm-hmm.
when the power goes out,
Mm-hmm.
Computers don't
and our
work.
computers don't work. And so
It
this-
kind of
our
forces
server
you into
doesn't work.
planning for this, doesn't it?
What's that?
Kind of forces you into planning for this.
Oh, we've been planning for years. It's always good to have an action.
Yeah.
Because then you find all the gaps
Yeah.
that you need to fix.
And how'd you do?
We found gaps.
Yeah.
We did good.
We found opportunities.
We found opportunities to improve upon
Good.
it, so that's good, yeah. So any questions about, you might have read it beforehand, and you can get questions on. That's all I have.
The one other thing that I might add to this, it's not in the report, is that I've been working with the coroner's office and with our deputy registrar. So officially, I'm the chief registrar for this county, for birth and deaths in this county. And and Dave also looks at the death records as well. There's a lot of discrepancy in what is being filled out and as to what is acceptable in terms of the cause of death. So physicians, healthcare providers fill out those causes of death. And every once in a while, we have to kind of send out a reminder that says, you know, stop breathing is not a cause of death. Okay, I mean,
Tobacco
they're dead because they stopped breathing, but stop breathing is not the cause of that. Something caused them to stop breathing.
Mm-hmm.
So we have to do those reminders, and so just sending out, actually check with the Department of Health, because it is my job to make sure that the cause of death is an accurate statement. And I'm finding that in a lot of cases it has not been. So we are now going to be refusing to accept it. And I asked the Department of Health if we can do that. And she says, yes, it is your responsibility to do that. So it may cause, and you might hear about it, especially the commissioners, because people might complain.
And it's physicians and.
It's the people that sign the death certificates are the physicians, healthcare providers. So an ARNP, a nurse practitioner, anyone in attendance, and the coroner, and the coroner's deputies, and myself. So we are the people who are legally responsible for signing. And there are times when the doctor refuses to sign, or there's somebody hasn't seen a doctor for a while and it's a natural death. And the coroner's office does not normally take jurisdiction over a natural death. They'll try to find a doctor to sign, and sometimes no one is willing, so that ends up being delayed. So they can come to me and I can sign it, but because I don't know the people, I have to actually investigate. So then it delays, there is a delay, because I have to look at medical records, I have to look at the circumstances, I have to do an investigation in order to determine, to my best judgment, how the person died, without doing an autopsy, just looking at the circumstances. So, sometimes it's fairly simple, it's a witness, somebody clutches their heart, falls over, they've had a history of high blood pressure. I mean, you can surmise what the cause of death might be, but it's going to be the doctor, the person who is taking care of the patient. It is going to be their best medical judgment as to what the cause of death is. The only time you can be 100% or even close to 100% accurate is when you've had an autopsy done. and there's, you know, clear evidence that tells you that these are the things that, but not everybody has an autopsy.
Mhm.
But, so the system works for the most part. I don't hear from the coroner except when somebody doesn't get their death certificate, and then there's a lot of interchange. But I've been reviewing for the last 18 months every single death certificate, and I could probably put a pile about yay high the things that I would actually send back and say, just be more accurate as to what you say.
Mhm.
And sometimes it's very, very difficult.
And how can our statistics be right for our county?
Right. That is the bottom line, is that in order for, to really figure out the health of our community and what's causing the members of our community to die and what they're dying of, we need to have more accurate data, and part of that data is the death certificate information that's put on there.
We've had some interesting few
Yeah.
ones where you can see where it can impact data like died of tobacco use. Well, really? And we've always been known as a high tobacco use county, so we're very concerned about things like that, or stroke, or heart attacks. So it does impact the data because we have small numbers when you're looking at data. So we want it to be really accurate.
So just wanted to kind of alert you that you might hear about it and understand why there might be a delay. And we try not to, because we understand survivor benefits are very, very important for next of kin, and to be able to get that, you have to file a death certificate. And our staff has really been very, very good and understand it very well, but they're often treated as clerical staff and dismissed. So I'm just right. You know, no, they have a job to perform, and their job is accuracy and making sure they know what they're doing. The funeral directors are our partners in this, and they often get caught in the middle also. And so it is tough making that decision. So, sorry for that little.
Do you have anything else, Lydia?
No.
Okay, thank you. Yes. Next, we will do board membership resolutions.
So it's in the red folder, and this is the resolution from last fall, which did not get.
This was it from last fall.
Right.
Yeah. Okay. It did not get
Signed.
signed, so we need to get that.
Did we approve it already?
It'd be cleaner if we just
Did it again?
revote it and
Okay.
sign it.
Okay.
Do we need to, we're not gonna have to read it, are we? To vote it? Do we need to read that to vote it?
I need to wake up on it.
Yeah, Randy, yeah, you
It
can.
was sent out.
Yeah.
Ordinance amending Board of Health Ordinance number 01-13 concerning the composition of Mason County Board of Health. Whereas RCW 70.05.030 allows the Board of County Commissioners Board of Health and its at its discretion to expand of the size and composition of the Board of Health to include elected officials and persons other than elected officials as members, so long as the person other than elected officials do not constitute a majority. Whereas the Board of Mason County Commissioners believe that having officials representing other governments within Mason County will enrich the Mason County Board of Health through discussion of public health policy to ensure that the public health needs of the citizens of Mason County are being met. Now therefore be it ordained by the Mason County Board of Commissioners as the Board of Health that the composition of the Mason County Board of Health shall consist of 11 members as follows. 3 elected members of the Mason County Commission. 1 elected member of the City of Shelton Commission. 1 elected member of Mason County Hospital District Number 1. 1 elected member Mason County Hospital District Number 2. 1 elected member Mason County Fire Commissioners Association. 1 representative of the Squaxin Island Tribe. 1 representative of the Skokomish Tribe. 2 representatives from Mason County School Board districts, 1 from the south end and 1 from the north end. be it further ordained that all members of the Board of Health shall have the ability to vote on all issues pertaining to public health policy and priorities. However, any Board of Health supported issue requiring additional funding from the county will be forwarded as recommendations to the Board of County Commissioners for final action, and be it further ordained that the quorum shall consist of at least one county commissioner and at least 3 other members. Be it further ordained that the members of the Mason County Board of Health shall serve terms consistent with the terms of the entity they represent, and be it further ordained that the members will serve without compensation, but may be reimbursed for travel expenses approved by the Mason County Board of Health, and it will be passed on this date. So I therefore make that a motion.
I'll second that. All in favor?
So Dave, should I vote on this then since it was, okay.
Huh? We're doing it now, then you would have to.
Yes, you would.
Because it explain what happened.
So,
It's not in the minutes.
What happened, I think, on that one was that December board, we didn't have a full quorum, and it came forward, and it sat, and I thought it had passed, and then we went back 2 minutes, and went, oh, we need this done.
I don't think it did. I think we actually put it off because we were just gonna ask the coroner if he wanted to participate. And it came back that he did not.
Right.
So I think we didn't actually vote on it.
So, in any case, we'll get it done, it's clean, and move forward.
So, but I have a question. Because we've got an 11-member board here and I've never seen representatives from the school districts, College Tribe, Squaxin Tribe on the board.
Well, now
Does that
it's
count against our quorum?
no,
Okay.
no. The quorum's not based on percentage. It says 1 or 4.
Okay. Thank you.
So then it'll be up to us after this, if this passes, to put the
To go out and
request out.
review. Right.
I know we have a member, but you're probably not representing the, okay.
I'm an employee, yeah, not a member of the tribe, you mean?
Yeah.
Yeah, well, that-
Just
This
says
is a representative of the.
yeah, that's a
tribe.
representative, but they didn't send you to do that, so then,
Not today,
okay.
no.
Not to interrupt, I just pulled up the September 27 minutes from 2016, and it was passed at that
Well,
meeting.
I thought it was.
well, then we don't need to do anything.
Did it not get signed around? Is that the problem?
I don't know, I wasn't here.
I don't think we signed it.
I don't remember.
Because I know it didn't get signed.
Well,
I've never seen it
I'm
signed.
surprised we actually went, because I remember us asking me to go out after that to see,
I think that was in January.
well, not December?
This is from September.
September.
It was September.
Yeah.
Well,
So
then-
you can
then-
repass
then-
it.
Yeah,
Just
Yeah.
repass it.
We'll just, so it was already voted on.
no, but
No, we
we
need
can,
to vote.
the
Okay, all
Commissioner's
right.
correct, we can repass it, it's already motion on
Okay.
the floor,
Motion to accept this
Is-
has been made and
has
seconded.
been made and seconded. All in favor?
Aye.
Aye. Opposed? Okay, let's get that little bit
That's how
confusion out of the
sausage.
way.
Yeah, that's awesome. Okay, so, next thing is
Annual report.
annual report, hot off the presses, and this is not going to be the final presentation copy. So this is for the entire community services. So includes public health and development. So we're going to get this done on better paper and get it bound and make it look good. So,
Can we look at a copy?
yeah.
Okay, great. Pass a couple down, please.
Yep.
For free.
Spelled my name wrong.
No. Did I? Okay, that's, all right.
Is mine spelled right? Mine's one, I was spelled wrong. I'm okay, is it?
Okay. Such a pretty picture.
So the picture on the front was actually taken by one of our employees on her way to work.
Really pretty.
Yeah, so Janelle took that. She lives across the street and walks across
Oh, wonderful.
and stopped and took the photo. And
And the little
That should be your-
thing on your shirt.
so the
It
logo-
looked like a manger at first.
So
That's why I was wondering, what do you have a
I'll
manger?
take a look at it.
those are- it's a representative building.
Right, yeah.
We're doing this as the board.
This was designed by one of our staff.
Right.
Oh, okay, is that new?
It's new.
Yes, new. So as part of the whole branding, we're trying to get you know,
Very
Mason County
nice.
Community Services out in the public as a single
Yes.
entity,
Brand new.
you know, as opposed to, you know, all these separate divisions.
Yes, okay.
I like the ruler on there at the top of the house.
Yeah.
Measurement.
Yeah. So it starts off with just a quick review of, for me, of the year. Moves into leadership. We talked about the mission, and we'll need to get back to this. We're working on strategic plans. We're going to refine the vision, mission, those statements as we get through the strategic plan. So next year's will have more detail on that than this year's does. We did talk about, we go initially into the administrative and finance. So as like Dr. Yu was talking about at the bottom of page 1 there, vital statistics, it's copies the birth certificates issued and copies the death certificates issued, not total numbers of births and deaths. And that is a different number. We then pop over into public health fiscal reports. At the all staff 3 weeks ago, I went through all these figures with all of our staff who had not seen this put to them in this way before, to show them, you know, where their funding comes from, how it's spent, you know, against what bars is it measured. So as you see, we get into public health expense. On the bottom of page 2, you'll see our pie figure there shows public health has, you know, a number of funding sources, which makes it a little more resistant to change when things go kind of wonka in the economy. Any one of those can get reduced without really hitting the whole organization that hard. We get over to the next page. It's revenue expense versus expense. So think of this monthly profit and loss. So we're up, we're down, and that's just kind of the way public health goes. I track these over the years and start to build trends so that if something changes, it pops out immediately when you look at, you know, figures like this. The bottom of page 3, the big spike in June represents a payment to Mason County of indirect services. So it was taken out in one lump in the middle of the year. So we were talking with county administration about possibly spreading that. So the money comes in spread, the money goes out spread.
That's a good idea.
So it doesn't look so significant.
Yeah.
So significant. So the bottom portion of that graph shows that the dark red line is the salaries budget, and you can see we're hanging in right below our budget line. You can tell when people leave and come back into the system based on that. Public health operating expenses is going to be something of a mirror of the expenses versus budget.
Wow.
But I wanted to make a point of the operating expenses being different than salaries and benefits.
Mhm.
So our operating budgets, we stay in pretty close. July and September, there are some yearly payments that go out, and that's why those kind of close in on the budget. We then go to the bottom, I break out the total salary, total benefits by FTE for the year, for the month, and then, you know, as an average per FTE. So that's just kind of big sketchbook kind of planning numbers. If you're interested, we've got community development fiscal reports. We go into that. On the bottom of page 5, you see that community development has really 2 major funding streams, licenses and permits and goods and services. So it's more connected to the economy. If the economy changes, funding in that changes much more dramatically. But it's also in some ways insulated from the whims of the legislature because it is fee driven. So there's plus and minuses to both kinds of funding. We get back into the next page. Same sorts of things, revenue versus expense for that profit and loss. We stay up pretty well during the year. Salaries, we were a little bit lower than we anticipated last year, but we had some unfilled positions for part of the year. We had, for example, 2 code enforcement positions that weren't filled. I didn't come in until halfway through the year, and Barbara Adkins left towards the end of the year. So, and that also contributed to the revenue being high at the end of the year because of those unfilled positions. Operating expense, as you see, again, we have 1 month that leaves out, and that's in April. But the rest of the time, we're doing well to stay under budget, so.
And why is that? Why does?
On that one, we had some indirects come out, but we also had some other expenses. We had, there's once-a-year expenses come out in April. For example, previously I would have all my insurance come out in 1 month.
Mm-hmm.
And so that spikes your payments for the month.
Okay.
So. Then we go into just the reports. So your community health and human services activities. We really took a little deeper look into the programs. We talked about children with special health care needs, which is one of the ones that's foundational to public health. It's a requirement for us to work with communicable disease, early intervention. So we break those out in the next few pages in some more detail with good descriptions that go along with those as well. The purpose of this document, I should be able to hand it to anybody in the community and have them gain an understanding of what it is we do. So early intervention programs. We talk about school immunization rates, and that's just some good to know information. I can tell you it's much better here than where I was previously.
Well, I have had a question about immunization
Sure.
of children in school. What do you do with the children that are not immunized and their parents refuse to immunize them?
They sign an exclusion statement so that if we have, say, a chickenpox outbreak, they are immediately excluded from school until 21 days past the last child that shows up positive for, in that case, chickenpox.
Okay.
They sign a exemption
Mhm.
waiver in the school. So, the exclusion is a tool that we use for certain diseases. So, but a parent in this state, the law allows them to sign a waiver saying they refuse to be vaccinated.
All right.
There are consequences which we can implement
Mhm.
if a disease outbreak occurs.
Mhm.
I have had to do that in Honduras County. We had to deal with the school. And actually in Stevens County as well. And I think we had over 100 kids excluded the first day. It was amazing how it dropped to like 20 kids the next day. So parents either found their records or got kids vaccinated. Whatever it took, they got them back in school.
Yeah.
A lot of times it's just not having the records, but that's not as bad now, because they do have a chance to get the records in. So most of the people that are not vaccinated have chosen to not vaccinate. It used to be in the past that you expedited getting them registered
Mm-hmm.
by just signing the waiver. But now, to get the waiver, you actually have to go to a doctor and get the doctor to sign it. So it's harder to do the waiver. So the people who do get the waivers it's more of a real, they're not vaccinated as opposed to in the past.
All right.
And if you notice at the bottom of page 11, when we talk about the exemptions, we're really low, we're really looking
Yeah.
good in this county. Our schools do a really good job
Yeah.
getting everybody vaccinated. So,
Thank you.
One of the problems we have is there's two different systems in the state. So the schools use Blue Sky Blue, in their own system by which they track. And we use the Washington Immunization Information System, which used to be child.
the school uses the WIS here too.
Oh, do they?
Oh, yeah.
Because I've used, it depends on who it is.
Washington.
Other school districts do it differently.
Immunization.
Yeah.
So if they're using
The
Wiz
schools
here, that's
use WIS
great.
here, yeah.
But now it also includes adults, where it didn't used to.
Yes.
So they've broadened the program.
Okay.
Again, tobacco program, tuberculosis, housing, all those things we've been doing, mental health. We try to put numbers to this, so there's some quantitative things as well as the qualitative things. Then on page 17, we talk about, just all the different programs and other organizations we touch. And that certainly I don't think is exhaustive. We've been going to environmental health, and we've broken that out by cost per program as a percentage. We go into shellfish protection, drinking water, and then I asked Debbie on this, on environmental health, to at least give us 5-year trend data, because if we just took snapshots, that's not a real accurate way of looking at things. So, especially on environmental health things, we presented this in trends. So you see on page 22, solid waste 5-year trend. We really jumped up in closed cases this year, and that's because we had Maria working those, and she has been just very diligent in getting out and getting cases investigated and closed. So, food program 5-year trend is up. We have more people getting their food handler cards online. And that's been a real boon for both the consumer, the people getting the permits, as well as us. So we do it through Tacoma Pierce runs the program for us. They keep $3 off of each $10 permit. Well, actually money ahead because we have so many more permits being done. So, and we don't have any staff time involved where we used to run classes.
Right. I just took that online class
Yeah.
today, got my new permit.
And that's through Pierce County?
That's your Pierce County,
Tacoma
right?
Pierce.
But you go to our county website and it just takes,
Right.
it's completely seamless. You can pay for it online, they print it at home, give it to their employer. It just expedites getting people back into the workforce.
Yeah. My daughter has to do hers online when it's due, and she loves doing it online.
Right. Yeah, we used to have, long lines of people coming in for classes, and we don't have to do that
I
anymore.
remember the classes,
Mm-hmm.
yeah.
On site, you see our total number of permits are up, replacement permits are up some. Trending up from 2014 to 15. Operations and maintenance really is kind of the glowing thing. The trend is really up on operations and maintenance. And that's a lot from voluntary compliance. People getting the letters and saying, okay, get their tanks pumped, they're inspected at the same time. And the pumper sent us a pumper's report and lets us know where those failing systems are. My system last summer, when I was buying my house, was a failing system. So that had to be addressed during the real estate exchange. So. Water rec, vector program.
What is vector?
So that could be bats, it could be dog bites, it could be mosquitoes.
Okay.
I'm surprised here mosquitoes aren't as big an issue as they were in Stevens County. It's a much bigger issue.
That's
So,
also water are bigger.
yeah,
We have working wetlands,
Yeah.
so we have critters eating the larvae.
right. And then we go into the Permit Assistance Center, so we look at Permit Assistance Center, and that's the planning building end of our organization. So we have a lot of people come through our front door in a year. And this is where we really want to take the whole permitting process, both environmental and through the community development online. We're looking at software that allow us to do, people to put even submit their plans online and be able to track their plans, building permits through the system online as they go through the process.
That's very cool.
So it's going to take an investment. We have some ideas on how we're going to work it. We have some infrastructure things we have to correct to begin with. But it's a place we want to go. KidSAP has just gone there, just say nothing but glowing things about how the program is working for them now.
Well, it's kind of saved staff.
Right, and what it'll do is allow us to spend staff time on the really much more difficult, on-site plans, houses, whatever, it really means that front counter person instead of a fence or a deck or a simple re-roof.
Mm-hmm.
You know, so let's spend our staff time in a smart way. And then let people like to help themselves. It's just the way it is. Building permits are up a little bit this year, or actually last year. This year, it's about flat, like last year. Code enforcement was up again last year. Fire marshal was interesting. We had more investigative cases, and the cost on investigations goes up. So that is the Mason County Community Services report. Like I said, we'll get Commissioner's name fixed.
Thank you. I wanted to call your attention to page 10. And I turned around to ask Lydia to double check the number for syphilis. That's quite a large jump. And I know that in the last year and a half, we've had an outbreak of syphilis, but the outbreak is also associated with gonorrhea. So what I'm looking at that number and I'm questioning it because the gonorrhea numbers were not that far increased, but the syphilis numbers were very, very increased compared to 2015. So we're gonna double check those numbers. Just wanna make sure to call it out so that you're not surprised by it.
Well,
The other thing is that the syphilis, the sexually transmitted disease, the syphilis cases are handled by the Department of Health. We do get the reports, and then it's the Department of Health that works with the provider in treating the cases. So I don't have firsthand information on these cases as much, but we'll double check the numbers. Because the outbreak has been very large in the Seattle and Tacoma area. So, I mean, we get some, what do you call it, bypass.
Fallout.
Fallout, yeah, I guess I'm sure the numbers in Thurston are high too. But I didn't expect it to be quite that high compared to the gonorrhea.
That kind of leads me to I was kind of surprised at the Hep C numbers in your quarterly report. I've been 114, I didn't realize we got that many cases. Now I'm looking down at your annual numbers, if that trended out, it seems like it'd be a lot higher. So is that seasonal?
So, yeah, the thing is that the Hep C that we get, that we work on, a lot of times are chronic hepatitis C cases that are reported. The one on page 10 is talking about acute cases of hepatitis C. And
So on the report you just gave us, the quarter.
It's chronic too. It is chronic in that same report. The difference here is what's happening a lot of times is we get reports in because right now that hepatitis C can be treated. So a lot of providers are now starting to retest people. So lots of testing's going on. Many people are being found that they're chronic, that they're getting tested, and then they're monitoring them so they keep getting more tests. So we still have to pass those through and look at each one of those. That's my quarterly report. This data here comes from the state, and so this is coming down as far as new chronic hepatitis C, new cases identified for the year. So the other is chronic that's probably been identified a few times.
Okay.
Is that what you said? Did I just say the same thing you said?
Yeah.
Okay, sorry.
what's the difference between acute and chronic?
Acute is when you first are identified as having, and you are physically very ill, turn yellow, all of that. Where chronic,
they've had it.
they've had it,
For
they can
years.
they can be a carrier.
Okay, all right.
And now they have treatment, which is, just been in the last couple of years that treatment's become available, so.
And many people be asymptomatic for as many as 30 years.
And they wouldn't
And not
know
even
they
know.
had
Not
it.
even know.
Yeah.
That is why the general recommendation is for every person to have the test done at least once in their lifetime.
So if they've had it for years and they really don't know it, that would be chronic, right?
Yes.
But then they move to acute if it's.
No, it might just be somebody that's actually contracted
Okay.
hepatitis C,
Okay.
and they're being treated in the hospital usually, or they're pretty ill.
We actually very,
We don't-
very rarely see acute hepatitis C or B.
Right.
When we see an acute hepatitis, it's usually A, which we don't see a lot of.
Mm-hmm.
So we have very few people who turn red, jaundice, yellow,
Yeah.
glow in the dark yellow like we used to. We used to have hepatitis all the time. It's just a trend of the disease. It went in patterns about every 7 years. And then we started vaccinating against hepatitis A, and you'll hardly see it at all.
And a lot of your hepatitis C, you'll see in conjunction with HIV and shared needle use.
Mhm. So do we need to make a correction on,
We're gonna
That-
research that. No,
but,
because this is just
okay,
this is
so are,
just our first draft.
okay, so we do not need to make a motion to
Motion
accept
to
that,
vote.
it's the first part of it, okay. All right, thank you.
This is a tool that, it's a great informational tool, but we also will use this tool. We're the first time this has been done in the state where we've had a combined department of community development. So we want to be able to show people what we're doing, and it also allows us to use this as a tool for grants.
Mhm. Do we have any other business and board discussion?
Yeah, I think that, if I can, Madam Chair, I need to go back to this ordinance that we just passed. There's some issue with it, and I'm not sure how this is going to be rectified or how we should rectify it. Historically, for those that weren't here, the county commission was the Board of Health, and it was just 3 of us for the longest time. We passed an ordinance, which actually was 113, when we decided to change it to a different board structure for voting. And this particular ordinance that we just read and put in, either has to be cleared up one way or the other. It says here, now therefore be it ordained that the Mason County Board of Commissioners, as the Board of Health, that the composition of this Mason County Board of Health shall consist of 11 members. And that's one of the things I was reading over, and I was getting stuck on it when we asked. So I don't know if there should only be the 3 of us signing that, because do we still take the historic route that it's at our discretion on how the board is set up? Or do we change that to where it's has everybody signing it, saying it as the Board of Health of what was constituted as of 113 for this resolution? So that's, does that clear as mud?
No, I get it.
So if we still retain the ability, then the commission just passed it right now, the 3 commissioners just passed it. But the word should actually reflect that, or it actually does reflect it.
Right.
If not, then we need to change the verbiage if they're not.
I think if you go back to RCW 7005, it was still the underlying authority is the county commissioners.
Yeah.
Yes.
So then that would make this accurate then, but then we still need to change the signature lines to just the 3 signatures thing.
Mhm.
Okay, that can be done.
And we did pass it.
And then we just get it.
Yeah,
And
yeah.
You okayed it too, right?
Yeah.
So all 3 of us did.
Okay.
Yeah,
Okay, so let's just change it to 3
Okay.
signatures.
okay, so do we,
We don't have to.
You don't need to do anything.
yeah, okay.
Our
Any,
clip earlier is all over it.
Actually, I had a comment as well.
Okay.
So I wanted to call everybody's attention to an event next week, May 31st, at North Mason High School. In the past, I think Commissioner Jeffries, you attended last year, but my wife, school nurse there, she has a partnership with Olympic College and their bachelor's candidates in nursing. And they come in and they do community health projects in the school, and then at the end of the year, they do a presentation on their research. And so this year, they had 2 groups. I believe 6 nurses participated at North Mason, and the topics that they covered were vaping and then promoting health literacy in youth. So it's a great opportunity to come and hear from nurses who are getting their bachelor's degree from Olympic College. So that's next Wednesday, May 31st from 3:30 to 4:30. I know they've worked very hard. I've heard a lot about their efforts, and looking forward to hearing their presentations next week.
It was a good program last year.
At the high school, at North Mason
Yeah,
High
at
School?
the auditorium.
Okay.
I do plan to go, so if anyone wants to carpool.
Great, thank you.
Thank you.
Wanted to share too that the mobile crisis response team, which is being staffed by the company called Telecare, is up and running. They are to be second responders, so to speak, to law enforcement who have encountered people with behavioral health disorders. So they're up and running, and they're meeting with law enforcement agencies to kind of set up protocols, et cetera. So that's up and running now on that side.
Do you have any update on the building, PUD building, as far as how that's coming?
Yeah, so we just approved the contract for the architect to design the interior redesigns, and then next will come the project manager, and then we'll put an RFP. Once the architect's done, put an RFP out for the construction. Kind of a very, very, very conservative open date. I'm kind of disappointed that the BHO staff is putting out about next summer, but I'm hoping it'll be a lot sooner. They just don't want to get people's hopes up.
Yeah, okay. You keep us posted on that.
Mm-hmm.
Very good. Any other? Any public comments? Yes.
Okay, here we go.
Okay.
So I'm Erica from the Squaxin Island Tribe. I'm a hydrologist, and you guys are starting to get to know me well here. I work with Stephanie, so
Yeah.
and Debbie knows me, and I don't know you guys, but maybe eventually. So anyway, I just came to input some remarks about a clean water program. I was here 2 years ago, and slightly different set of commissioners. I delivered a letter, as did Taylor Shellfish and Skokomish, and so I have copies of those because it's the same message as it was 2 years ago. A clean water program is a basic government service. It should include septic system management, farm plans, water quality samplings, and outreach by the county. The tribe has had a good working relationship with Mason County Public Health, Debbie and her employees, for quite a few years now. We work together on grants collaboratively to do water quality work. And I expect that the EPA funding is going to go down the toilet. So that's what the county has relied on for a clean water program for the past over a decade. What's the next step? That's my question for you today. And a few other notes. Closure areas. So the head of Oakland Bay, as far as shellfish goes, is closed to harvest, and Chapman Cove and a couple other places in Oakland Bay, oftentimes rainfall closures. And there's permanent closure around the wastewater treatment plant, and we've had 3 localized closures in Hammersley due to norovirus. One of those is Church Point, which is the senior harvest beach for the tribe, and it's been closed for quite a while. And the Mason County, like I feel that they do very well with their funding that they have to work efficiently, but they simply don't have any funding to put people on the ground in the Hammersley area. Department of Health, Washington State Department of Health is working it, but the county doesn't have staff. So that means that they can't be proactive in heading off these issues. Only a proactive health department can counter that, and they need the backing of the commissioners. Here's a quote from Bill Taylor Shellfish in his letter from 2 years ago. The nature of non-point source pollution is that it needs ongoing outreach, education, water quality monitoring, and enforcement. To effectively manage non-point pollution, in our opinion, requires some level of dedicated funding. It can't be accomplished only with grants. It's just the way it goes. A few stats on the tribe's shellfish harvest. If I can find Eric's email. Okay. Between a quarter and a third of all Squaxin Island tribal members depend on at least some of their income from shellfish harvesting. And this year, over half of our clam harvest came from Oakland Bay, and 90% of the tribe's clam harvest come from Mason County. Income from tribal harvest not only goes to tribal members, but also to the state and private tideland owners on their beaches that are leased. Recently, the tribe has been directly affected by poor water quality, as I just quoted. And another note on that, not having good water quality and allowing it that the tribe cannot harvest is an affront to their treaty right. So U.S. government makes a treaty with the tribe to say you can harvest shellfish here in perpetuity, but she can't. You can't because the water's dirty. So it's an unfortunate thing. And finally, my last thought for you is don't fear the poop tax. Okay? Did anybody follow Thurston County's poop tax and the rescinding of the, okay, great. So I went to a few public hearings there and the public was very upset. I don't want to see that come upon you. However, this county doesn't even have the program that county has. And so maybe they have issues with service and how they get things done. It appears to be, according to the public. I just feel that you would be justified in working on localized funding here to get something going, to get a basic program going. That's it for today. Thanks for listening. Would you like the 2014 letters or, okay, we'll get.
They might
I got them somewhere.
Okay.
Thank you, Erica.
If I could respond.
You may.
I'd very much like the county commission to consider a poop tax. I've asked the commission to consider it, was approached by another commissioner that he would like to propose a different strategy. I haven't yet heard what that strategy is yet. And,
Okay.
But just to let you know that I have proposed it to this commission and a previous set as part of our stable, predictable funding for our water quality.
I think Debbie has brought it before us twice now, isn't it? At least since I've been here.
Since you've been here,
Yes,
yes.
Okay. Well, that's good news. Yeah. If there's any way that we can be supportive, let us know. We are supportive.
Yes.
Any more public comment?
Yes, you may.
Okay. Hi, and so I'm Constance Ibsen, and I'm here as two things. Member of the Lower Hood Watershed Coalition, and also with the Hood Canal Improvement Club. So the Hood Canal Improvement Club, we are looking forward to making some movement on Big Bend Creek and the Hood Canal Big Bend cleanup. Because people want to have their shellfish harvested on their tidelands so they can pay their property tax. That's the information that people call me about. So one of the things that we're starting, and it starts Monday the 29th, I think this is our 25th or 27th year of doing that, is the State of the Oyster Study. And so in case anybody, just so you know in the back of your mind about it. So this is where people bring the oysters from their tidelands and their clams, and they bring them to now just 2 points on the canal for pickup, and then we get them to test. So they can test their oyster meat for fecal coliform and for Vibrio. And so usually we get a pretty good turnout for this because people don't want their visitors to get sick. So we're starting that, and here's the flyer on that. And this is the little form that they fill out. And so this is not a government program, so we get people who come in and, and it's all kept, the data and the information is kept by Terry King with the Washington Sea Grant, so she's not a government person, so she can call, and it's just by address, and we don't see the data, so it's all good. And then last year, because remember in Tacoma there was a big, a lot of information in Tacoma about lead in waters, particularly for the schools. So we had people wanting to test their water. And so we offered that also for fecal coliform or lead. And so this is the same form, and they bring it to the same sites, and then we run those tests. And it's interesting because AmTest is a lab that we've been using all these years, and she is the one who's gotten the contract to test all the schools. So that is another service that is there. So we start, it's the Memorial Day weekend, we start on that. So just to let you know about that. Do you want these, or just maybe he needs to know about them too? He probably doesn't want to know. Here, yeah.
I can put it on my backside.
Thank you, Constance. Okay.
Thank you. Any other? Well, we're going to, we will adjourn. Our next meeting will be
In July,
in July. What's the date on that?
July 25th.
July 25th at 3 o'clock, Randy. Meeting is adjourned.
Thank you.
As soon as I get this one, I can change it back to 3:30 again.
I don't know why.